Well, if you have swollen joints, you know how difficult it can be to move.
Yeah, but there are some things you can do that are proven to reduce pain and increase strength. Joining us now is Marjorie Shep. She's with the Arthritis Foundation. In just a bit, we're going to tell you about a special program that's happening this Saturday for people diagnosed with rheumatoid arthritis and their family and friends. Nice to have you on the show today.
Thank you. Good to be back.
Yeah, so today we're talking about rheumatoid arthritis,
Right.
which is different from osteoarthritis,
yes,
right?
Yes. There's 120 different types of arthritis, and the two most common are osteo and rheumatoid. And osteoarthritis is more of a degenerative joint disease, whereas rheumatoid arthritis is actually an autoimmune disease. And because of that, it's systemic. It affects your entire body. Typically mirrors. So if you have a problem with one side of your arm on one side, you'll have a problem with the other side. Whereas OA is more like one joint that maybe you overworked. It also being an autoimmune disease, you will have, your entire body will not feel right. You'll have higher temperatures, sometimes a fever. You'll feel weak and exhausted. So it's much different than osteoarthritis. And because of that, there are different requirements for when you're exercising. You fatigue much more quickly than somebody who doesn't have arthritis, or even somebody who has osteoarthritis or one of the other forms of arthritis.
Does this affect a certain age group?
No, children can have rheumatoid arthritis, called juvenile rheumatoid arthritis. I've met children who are 5 and 6 years old who have juvenile rheumatoid arthritis. It can affect at any point. We don't know what causes it yet, which is one of the other things that's an issue with it. And unlike some of the other forms of arthritis, it not only affects your joints, it affects soft tissue. So it can affect, you can get lesions on your skin, you can affect your heart, your lungs. It's a very serious disease. You need to be diagnosed and have it under control.
A lot of people will report pain with this particular disorder. How do you break out of that cycle?
First of all, the pain cycle is something that is very real. You know, you have pain, you immobilize your joint, immobilize any part of your body that you have pain in, and when you immobilize it, that causes you to not be able to function properly, which causes you to have bad self-esteem, and that gets you depressed, and you have more pain. So in order to break out of that cycle, you can do multiple things. Exercise is an excellent form of breaking out of it because it increases your endorphins. It helps you to strengthen the joints and the muscles that are bad so that you can do your functionality again, and if you're functional, then you're not as depressed. So exercise is a really key point to breaking out of that pain cycle.
Okay.
Well, I can imagine that that would be helpful, but one thing you kind of mentioned before is that you fatigue easier, you get more exhausted. It can take more energy to do regular activities if you have rheumatoid arthritis. So how can you manage the importance of exercise with being able to not overexert yourself?
You have to make sure that you're exercising with somebody who knows about your disease, first of all. You know, you have to let people know, yes, I have rheumatoid arthritis. And when you are exercising, you have to make sure that you can take rest breaks. So let's say that you're going for a walk. You have to be able to make sure you can sit down somewhere. You have to manage your activities through your day. If you are a working person, make sure that I'm going to take a rest every 10 minutes or so with something like the exercising. If you are in the office situation, every few hours, relax. Do something, do visualization. Visualization and deep breathing are an excellent form of pain relief. We can do it right now. Close your eyes.
Okay.
Everybody close them. If you're at home, close your eyes. Take a deep breath in through your nose, pushing your stomach out as you inhale. And as you exhale, blow out through your mouth. Slow and controlled.
Oh, I'm not supposed to open my eyes.
No, don't open your eyes. Inhale through your nose. And exhale through your mouth. Now, if you have any stress or any pain, visualize it, give it a shape. And as you inhale, think of that shape, and as you exhale, shrink it down to the size of a pea. Inhale. And as you exhale, shrink it down to the size of a grain of sand, and then blow it out of your mouth, visualizing that pain or stress going away from your body. Open up your eyes. Do you feel more relaxed?
That's great.
Yeah, so that's a natural pain reliever. You can do it anytime. A stress reliever, you can do it anytime during the day.
What about exercising? What's a good exercise for people with this type of arthritis?
Actually, any form, but the biggest thing with any form of arthritis, and especially rheumatoid, is you want to strengthen the muscles supporting the weak joints. Sometimes in rheumatoid arthritis, the joints will actually completely disintegrate if you don't have it under care. You can get medications that'll put it into not a remission, but will prevent the joints from completely deteriorating. But when those joints start deteriorating, you need to have strong muscles supporting the joints. So let's do, and also with there, we talked about aerobic activity. You want to have it slow. We can do hard exercises in the chair. So this is what we're going to do. We're going to start from the head and work all the way down. So you face straight ahead, chin parallel to the floor, and turn your head to the right, and come back to the center, and over to the left. So we're working the neck and center. Bring your shoulders straight up to your ears and down, not forwards. So you're going forward.
I am?
Yes,
Did you hear it all crack too? That's probably
straight up to the ears, and now rotate back. We don't want to go forwards because we have a tendency of going forwards. This shortens up the muscles. This puts strain on the neck and the back. So up, forwards, and back. So we've done our neck and our shoulders. Let's drop your hands down and bring your hands up to your shoulders and down. So you're working the elbows.
You have an event this weekend. Will you be showing people how to do some of these activities?
Yes.
Okay, so while we continue to do this, I want to make sure everybody has the information for how they can come out and learn more about rheumatoid arthritis,
Dave's
how to
doing
manage
it too.
that pain. We've got everyone in the studio is all doing it. Hopefully you're doing it at home. It's a full awareness program this Saturday from 9 to noon at the Community Conference Center in Wauwatosa, right on Watertown Plank Road. The phone number for more information, 800-272-3666. Find out more information on how to manage your RA and feel a little bit better. Thanks so much for being here, Marjorie.
Thank you for coming.
Nice to have you on the show.
It's always fun to be here.
Much more relaxed now.